Yeah, and Bill, while the timeline for the beginning of phase 3 is at least over 1 week away, whenever it does start, Governor Northam says that some of the restrictions in phase 2 will be lifted, but others will carry over into phase 3.
Among what will change under Phase 3 is social gatherings can be up to 250 people. Non-essential retail will no longer have a limit on the number of customers inside at one time. The limit will also be lifted for restaurants and bars, but physical distancing will be required.
Gyms and fitness centers may be open up to 75% of capacity, and swimming pools may be open at 75% of capacity with physical distancing.
But Governor Ralph Northam says they will still encourage people to telework, practice social distancing, and wear face masks when inside public spaces. In terms of when Virginia may start Phase 3,
as soon as we can do it safely and responsibly, we will, but certainly not before June the 26th.
Northam says while it is trending in the right direction, he's still watching Virginia's health data related to COVID-19 and what is happening elsewhere in the country.
As you have seen, there have been surges in other states that have eased restrictions prematurely.
Also at Thursday's news conference, Northam talked about addressing the disproportionate impact the virus has had on the Hispanic community, saying they account for 45% of the cases but are only 10% of the population. He says their work includes increased outreach, translating information about the virus, and partnering with Spanish-language media outlets.
Our Health Equity Working Group is tracking the data and working to make sure we are connecting with communities that are at a greater risk. And we are all using a health equity lens to make these decisions.
And a similar effort to help the Hispanic community is already underway here in the Richmond and Chesterfield area with assistance from the CDC. And Richmond's Health Director, Dr. Danny Avula, told me today that that team will remain in town for at least until middle of next week. And he says similar to what Northam said today and what he has found and the CDC has found is that distrust in that community of government agencies is a big hurdle. He says one suggestion they've been given to overcome that, and something they are looking at, is to establish a fund to give to people who don't have paid sick leave and need to self-quarantine, to give them some financial support, but to have that fund run by a nonprofit or philanthropic agency so that it doesn't have any ties to a government agency. Working for you in Richmond, Cameron Thompson, CBS 6 News.